when Laura and I developed these trainings, we had SLPs in mind, like what information do SLPs need to know about childhood apraxia of speech? But we also understood so many of these kids, these parents have had to learn so much on their own because they've navigated maybe working with SLPs who had no idea, had never seen another child with CAS, right? So these parents have educated themselves and learned so we could really present to them at a higher level. And then, as I'm going to get into in a minute, we wanted to emphasize the like whole child, whole family piece, and for SLPs to be able to learn from that too. So you are actually watching recordings with parents also sharing. You'll hear their voices, you'll hear their questions, you'll hear how we answer their questions to give you some guidance of how you might answer those questions when you're working with children and families also. Okay, so this comes direct from that article I mentioned from Dr. Edwin Moss, so the 2024 article. And in that article, he makes an adaptation. And he says, hey, this is how it can be exactly related to CAS. So the health condition of CAS, the body structure and function is going to be the speech motor planning. But what we're going to be talking about throughout this course is going to be the activities, right? So what are those child's limitations? How does that appear for them holistically? How is their participation in life restricted? And how do we factor those perspectives into our treatment? So if a certain model of apraxia treatment says we need X number of repetitions, but we realize this is a human and today they're having a bad day, right? We might say, how do I support them in their everyday participation that's not strictly related to their speech motor planning in that moment, right? So again, thinking that hopefully what's different about this training for you is going to be that broader perspective.